Hello, Dr. Don Jewell here for the Non-Surgical Clinic. Today we're going to talk about oxidative stress and poor mitochondrial function. This is a huge point in our office because with our cold lasers, we work in the mitochondria of the cell. We deal with chronically stressed people. So we give our patients a handout called Oxidative Stress and Poor Mitochondrial Function. Here's the video that goes with it. Okay. Mitochondria are the organelles in all of our cells, except for the red blood cells, where energy is made. Very important, okay? Nothing happens without energy. Oxidative stress destroys the mitochondria. So there are many causes to oxidative stress. Okay? Mitochondria produce energy mainly from glucose and fatty acids, which produces ATP or adenotriphosphate. So you've heard us talk about nitric balance and how the laser makes more ATP and how we're going to assess your levels, etc. It's a very important concept. Mitochondria require specific B vitamins. Most people know that as you age, you need your B vitamins. Well, that's true at any age. You also need your amino acids, L-carnitine, enzymes, CoQ10, and your minerals. We have specific nutraceuticals formulated to nourish the Krebs cycle. Most notably, we use Clearvite and Mitochondrial. You can get those off our internet store. Mitochondria control the immune response to infections. They're very, very important, okay? White blood cells need to respond appropriately to infections. Okay? White blood cells under-respond, unable to remove the infection. Okay? They get too low, they simply can't do their job. When white blood cells over-respond, the infection is exaggerated, okay? Which leads to a state of called systemic inflammation, and that's a whole nother video, a whole nother handout. Okay? Systemic inflammation leads to destruction of the mitochondria. The exaggerated immune response is also a trigger to autoimmune disease. And we also know, if you've watched our videos, been to our clinic, all autoimmune disease begins in the gut and the gut-brain axis. This is Functional Medicine 101. It's a vicious cycle, and it only gets worse. Remember, we are the best in the world at allopathic care. Traditional medicine, we're number one. Broken arm, heart transplant, C-section, you've heard me say this a million times, we set the standard. But for health and wellness, autoimmune conditions, etc., we are terrible. Those allopathic protocols simply don't get the job done. That's why functional medicine was created out of necessity. Autoimmune patients with systemic inflammation, are the most grossly underserved patients in the entire country. That's why we're currently in an opioid crisis. It's all due to systemic inflammation. Okay, apoptosis. It's this simple. Mitochondria control the death of all our cells, which is apoptosis. You have about 50 to 70 billion cells per day becoming dysfunctional and ready to die. But remember, this is normal, okay? The immune system's function is to get rid of these dead and dying cells. This is very important. We have to cleanse. Remember, your body's always regenerating. It's a normal process, okay? But if these dead and dying cells are not discarded, okay, they're going to linger, then they're going to replicate, okay? This is where things start to get bad, okay? This is very bad because the DNA of these cells is defective, okay? You've heard this before, right? This is the new thinking, but this is 2018 now. And functional medicine is very well established. This is the new studies and the new science, etc., are all proving these things, okay? Now, if these damaged cells continue to replicate, now you're replicating something that's not supposed to be there. It's damaged, it's dysfunctional, it's alternate, okay? Then you get abnormal cell growth, okay? And tumors result, aka this all roads lead to cancer, okay? Mitochondria signal the immune system to get rid of these cells. So mitochondria, they're very important. They have to be able to do their job. They have to be functioning. They have to be nourished. You know, they have a very important job to do. The mitochondria are the essence of life. So you've heard about DNA testing. If you watched our Zerona contouring video with lasers, we talk about how patients have a physiological age and a birth age, and we do the genetic testing or the DNA testing to see how old you physiologically are versus your birth age, okay? Mitochondria are actually directly correlated to your quality of life. I can't tell you how many patients come to me with such a low quality of life, and we ask them, you know, are you happy at this level, or do you want to come up a notch? Mitochondria, ATP, they all give you energy, okay? I don't know any patient who wouldn't want more energy, okay? And remember, we're a laser-based clinic. We're not just a clinic that has a laser in the back room. If you watched our laser videos, we're a clinic where we specifically took our clinical model and built it around cold laser therapy and functional medicine. That's what sets us apart from everyone else who just happens to have a laser in the back room as an adjunct. We actually use it because it is the most powerful medical device in our time. This is a paradigm shift. So you can see we're very passionate about lasers. I love my lasers. And we have all three, red, green, and purple, okay, Zerona, Virtue, and EVRL. Lasers, specifically the red, take the mitochondria up by 66%. So watch the videos for that. We will go into details. Okay, mitochondria signal the immune system to get rid of these dysfunctional cells through the production of substances known as reactive oxygen species. Going forward from here, we're just going to call them ROS. Okay? ROS is also known as free radicals or superoxides. Okay? ROS are a normal byproduct of energy metabolism. ROS signal the immune system to discard dysfunctional cells, which is apoptosis, keeps us healthy and cancer-free. This is a normal part of when your body's going through homeostasis. Oxidative stress is a condition when we produce too many ROS. Okay? Very bad things begin in our body and brain. Okay? Because we have too much. Okay? It's upregulated too much. High levels of ROS begin to damage the DNA. Okay? DNA not only exists in the nucleus of our cells, but also in the mitochondria. Okay? So, oxidative stress will damage the genetic material of our cells and the ability to make proteins in the mitochondria. Very, very bad. So we do not want oxidative stress. Natural systems in our body to neutralize these ROS molecules. Okay? Glutathione. It's your primary antioxidant. We have several forms of glutathione now. We used to have to use a nebulizer and injection. Thankfully, we've evolved in functional medicine. Now you can take it as a pill, a cream. Very, very powerful. You need it. It's your primary antioxidant. Good news is true cold laser via the red laser, and not the sham devices, which you've heard me talk about, it's been proven to cause your body to make more glutathione. Okay? Superoxide dismutase, SOD, okay, another antioxidant. Catalase, these are all very powerful. Glutathione is the most powerful, though. Okay, vitamins A, C, and E are antioxidants. Okay, think of them as tiny little hand grenades to ROS. Then you have glutathione, SOD, and catalase. These are like atomic bombs to ROS, so you definitely have to have these things. Okay, oxidative stress directly correlates to high homocysteine. We have another video and handout that directly talks about high homocysteine because most people have never even heard of homocysteine. Homocysteine is the inflammatory marker in your blood. It's the inflammation that takes and scars your arteries. It's that scarring that grabs your cholesterol. Right now, 2018, we know the biggest hoax in medicine is statin medication and heart attacks. Okay, heart attacks are not going down. Cholesterol is not the issue. It's the scarring in your arteries. It's the inflammatory levels. We use a product called Bergamot, which is like Roto-Rooter for your artery. Not does it only clean out your arteries, it restores that elasticity to the tissue. Okay, that's another thing we'll talk about down the road. When ROS molecules overwhelm our body's ability to neutralize them, then oxidative stress induces the following. You get uncoupling of the DNA, of the mitochondria. This leads to destruction. Okay? Fatigue, weakened immune response, autoimmune disease, chronic infections, blood sugar imbalances, tumors, growths, inflammation, and premature aging. This is why we test your DNA or your telomere length. The website's telomeres.com. This used to be a very expensive test, and now it's very inexpensive. It's pretty interesting to see how old your body physically is. It's a lot of patients are amazed. Okay, so the breakdown of the DNA in the nucleus of the cells. This can lead to premature death of cells due to an inability of the nucleus to reproduce new DNA, enzymes, structural proteins. Okay, which leads the nucleus beginning to express themselves inappropriately or cell mutation. Some people know this as cancer. Okay? The breakdown of the cell membrane, this cells breaking down on the membrane level. The cell can no longer control what goes in or out. Okay? This leads to premature death or dysfunction. Causes behind cancer, Alzheimer's, Parkinson's, fibromyalgia, diabetes, and all autoimmune conditions. You can see why point number 3 is very important, because these are all people who are not known to get better under the current model of care. Okay? So what are the causes of high ROS overwhelming our natural defenses of glutathione, SOD, and catalase? Okay? Number 1, inflammation. Acute versus chronic systemic inflammation. An excessive production of ROS. We live in a very toxic world. We're very toxic in everything we do, and we don't have time to heal or cleanse ourselves, okay? Leading us to a state of systemic inflammation. Remember, we have a handout for that, specifically called systemic inflammation. Here's the good news. This is why we love cold laser. This is why we've been using them for 15 years plus. True cold laser decreases inflammation, decreases pain. Remember, we talked about the 5 healing components to true cold laser, and number 2 is decreasing inflammation. So right now we're in an opioid crisis, we're in a chronic pain crisis in our country. People are suffering needlessly because they simply don't know how to get out of pain, and the medications aren't always working, and they have very dire consequences when used in excess. Okay, food additives. Okay, it's 2018. If you're still believing synthetic food is the answer, you haven't read the new science, okay? Pesticides. Roundup is probably the heart of the debate with the entire, gluten sensitivity situation. Hormones, okay? Animals injected with hormones, then harvested for food, are causing problems. Artificial sweeteners. We've known about this since 2002. One of my mentors, Russell Blaylock, wrote a great book, Excitotoxins, A Taste That Kills. We should know how bad MSG and the like are at this point in time. Okay? High fructose corn syrup, I don't care how nice and cute the commercials are, it is not good for your body, and try to buy processed food that doesn't have it in it. Good luck. Okay? Trans fats, MSG, etc. It takes a lot of energy to clear these toxins from your body. So the argument with high fructose corn syrup, oh, it's okay, you can have a little. The problem is you're not having a little, you're having a lot, and you can't clear it. You're getting toxic fat. That's the hard fat that you've heard me talk about with the multiple cell walls, because inside that fat cell is not only fat, it's all these insane toxins and chemicals that your body can't purge, so it's throwing it in a fat cell, adding on multiple cell walls to protect you from it. Okay, your body's not dumb. It knows what it wants to do. It wants to live. It wants to be vibrant. And it's going to do whatever it has to do when it's under attack. Okay. So the malnourished mitochondria has to work even harder to clear these toxins. So you have to eat real food. We all know when we eat bad food how we feel. And here's what I tell people. When I grew up in the 80s, it was a great time. We had junk food. We ate sugar. It was bad for you. But I'll tell you now, the food that is available today as far as junk food, the stuff that my kids would want to eat, I call that stuff lethal, okay? We had stuff that was bad for you. The food today we will call lethal. I won't let my kids have it because I love them. Okay? I wouldn't eat it. Why would I let my kids? Polluted air and water. Okay, very simple point. Good luck. We're stuck in a toxic environment. Cleanse your liver. Keep your body healthy. Drink clean water. Invest in a clean water system. Do your best to breathe clean air, okay? It's very difficult because just step outside your door, you're under attack. Okay? Low levels of glutathione. Remember, glutathione is your primary antioxidant. You need glutathione, okay? So watch the video or read the information about high homocysteine and the MTHFR genetic defects, all correlated to high inflammation markers, okay? Remember, good news, I already talked about this. True cold laser will make your body produce more glutathione. It's great. This is why we use it in our neurology cases. So we see the laser therapy video and the handouts. Okay, excessive UV exposure. This is a no-brainer, right? Okay, excessive suntanned individuals, their skin looks like leather. Okay, classic free radical damage. You have to protect your skin. It's your largest organ. If you put too much on it, it's going to show. But remember, true cold laser regenerates skin tissue. Not only does your skin look newer, it gets thicker and fuller, more resistant to sunburns. Pretty amazing. Our patients that are doing the upregulation component with cold laser therapy, they don't get sunburns like other people. Pretty amazing. Okay. Over-exercising. Forget the biggest loser mentality. Forget calorie counting. That is all archaic when it comes to body health and wellness and weight management, okay? That whole thought, it's 20, 30 years behind the times. You have to go on an anti-inflammatory diet. You have to modulate your exercise to not produce too much inflammation, okay? This is a no-brainer. We're all guilty of going to the gym and beating ourselves up. True story. My professional athletes do max out exercises. We give them an anti-inflammatory smoothie. We do cold laser. The next day, they do not have any muscle or joint pain, traditionally known as DOMS, delayed onset muscle stiffness. They don't suffer that, neither do I. When I do a max out routine, the next day I have full range of motion. I have no muscle pain. Now, back in Pittsburgh in the 90s, when I was in exercise physiology, athletic training, sports medicine, etc., we just accepted this as normal, as, the next day you're going to have lactic acid buildup in your muscles. My athletes today, who still follow me for my training days, they don't have that problem. We've learned how to go above and beyond that with functional medicine. Okay, you can overtrain, you can push too hard, and it induces damage via the INOS pathway, which I talk about in another video. Okay, chemotherapy and radiation, no-brainer. Okay, chemo kills more people than it cures. Just look at the statistics. Okay. Dramatically increases tissue aging. Just look at somebody who's gone through these treatments, okay? It's pretty intense, but it's the current allopathic standard of care, so that's where we are. I always think, aren't we smarter? Aren't we at a point in time where we can start to think further down the road? That's why I drifted into functional medicine. There's got to be a better way, okay? So this is a highly debated, highly political, emotional topic. We're going to save it for another video. Okay, I can tell you right now, in America, the only thing that can cure a disease are pharmaceuticals and surgery. We don't do cures in our office, okay? So just keep that in mind. We look at the person as an individual, address them, and let the body heal, okay? Heavy metal toxicity, cadmium, cigarette smoke. This is another no-brainer, right? Lead, arsenic, mercury. Kind of sounds like a flu shot, right? What are the ingredients in a flu shot? Just for fun, walk up to the front desk, ask your pharmacist for the ingredients in a flu shot. Now here's another highly debated topic. We're going to save for another day. We always find people with the flu, when we test their blood, the number one factor we correlate with people who are currently in a flu is low vitamin D. Just Google that, read the research, make your own decision, okay? Excessive essential metals, like iron, can be toxic if in excess. So we see this sometimes too, where the liver, pancreas organs are having a hard time doing their job. Okay, heavy metal toxicity is not a good thing. Okay, poor mitochondrial function. We have so many people that come into our clinic with low levels of mitochondrial function or just poor. We would assess them at probably a 60% level of function. My athletes are great. I love my professional patients who will do anything to get better or perform better. They perform consistently at 125%, 130% of function. These are also my patients who run major companies, or they have to be better than 100%. And so we take them, when you do cold laser and functional medicine, not only do we do basic restoration, which most docs simply do for pain. You've heard of the lipo lasers. There's another component to lasers where we take you even higher than 100%. These patients are great. Okay, this is where we heal broken bones in 2 or 3 weeks. These are where athletes get the gold medals, etc. These patients are a lot of fun because they are very driven. Okay, I have patients galore who are just sick, and they're great to work with, but sick people aren't always the most pleasant. But people who are willing to do anything are very easy and compliant. Okay, so your mitochondria. This deficiency in nourishment. You live in America in 2018. Our food isn't the food we were raised on. It's just not. I'm sorry. You're going to need supplements until our food comes back to what it used to be. Eating a very healthy diet, you have to be very diligent, okay? But even then, your food simply doesn't have the concentration of where it should be, so you need what we call nutraceuticals. Some people refer to them as supplements, okay? B vitamins, CoQ10, lipoic acid, L-carnitine, arginine, and minerals, okay? Now, when we want to assess your mitochondria, we just do organic acid testing, okay? And a lot of people are shocked at what a low level of function they have down in their cellular level. Okay. Summarizing, we have to identify and remove as many factors as possible. And here's the other thing, you have to stop, we call it suicide by lifestyle. You have to stop these things that are killing you. You have to stop these things that are shutting you down. For everything bad, you have to do two things good just to be back at zero. You have to do the right things if you want to be healthy and vibrant. It's just that simple. Okay? So then we get rid of excessive ROS production. You have to maintain healthy glutathione levels. You just have to. This is where you need a functional medicine doctor, or some people call us concierge docs, because we take you through everything A to Z. We look at everything. We're not just going to look at symptoms and chase those. We're going to go upstream and do our neurometabolic work and figure you out. This starts with proper testing, the comprehensive blood panel, genetic testing, food sensitivity testing, etc. If we don't have every piece of the puzzle, we can't put it together. Okay? You have to nourish the mitochondria and maximize ATP production. This is why we sell a product called Nitric Balance like crazy, because it's literally liquid ATP. Most people are shocked when I even mention that we have it. It's a nutraceutical. We go through our patients and teach them how to use it, because here's a little clinical pearl about Nitric Balance, is each patient has an optimal dose, and that dose can change based on the health of your Krebs cycle. So we're not going to just dump a blind dose. We're going to start with a simple dose, get a baseline, watch your change, and adjust your dose. My patients who take this before a workout, about 20, 30 minutes before a workout, are amazed. They're physically stronger. And it's that ATP that their muscles are craving. Okay? So you can see why our athletes love what we do for them, because we find that missing 2 to 3%. Our autoimmune patients, we just put their cases all together. Our patients in chronic pain, we figure out the inflammatory process, the chain, and why the pain meds just aren't helping them, et cetera, et cetera. And this goes all the way down to our just basic body contouring patients. Okay. So in functional medicine, there's a lot of things out there. I have a lot of docs I want to thank. These are my friends and colleagues who have made us better. This time, one of the best things I heard about, or how to describe a functional medicine doc, is we are where the Wright brothers were with flight when they're goofing around their garage and playing out a kitty hawk. But see, now all the sciences are proving everything we're saying. Okay, this is the new medicine. This is a paradigm shift. Then you take a functional medicine doc like me and throw in true cold laser, which goes to work in the mitochondria of the cell and induces all these massive things, okay? So in my doctor's group, I'm the cold laser guy. I'm a little maybe out there or different, but everything we do is reproducible and quantifiable. When you read the new research and studies, you see everything we're talking about, it's all there. No one's just ever been looking for it or put it together for their patients. So thanks for watching this video. I hope it helps. Remember, as a patient, you have this video in handout form, and anyone who wants to be a patient, just contact us, and we can shoot it out to you via email. Okay? Dr. Don Jewell, non-surgical clinic. Oh, last but not least, I forgot to mention some people who really pretty much helped me write this video. Remember, I'm standing on the shoulders of giants, as I call them. Dr. Michael Johnson, Appleton, Wisconsin, Dr. Ed Beyer in Tinley Park, Dr. Josh Huffman in Mounds View, Minnesota, and so many, I can't forget Dr. Dan Murphy out in California. All you guys are friends who are helping me help people. And in functional medicine, it's a very small world, and if we don't know the doc, we know of the doc. So I always like to thank the docs that help me do what I do. Okay? Dr. Don Jewell, non-surgical clinic,